Welcome to Riverside Chiropractic. My name is Shannon. I'm one of the chiropractors that works here. I was wanting to talk to you today about sacroiliac pain or pelvic girdle pain. Probably about 60 to 70% of lower back problems tend to come from where the spine and the pelvis attach. A person's occupation can be a big cause of this. If people are prolonged sittings, computer-based, sitting for months and years at a time will tend to weaken the muscles, the ligaments and the structures within the lower back. Pregnancy, of course, during the pregnancy, your body goes through dramatic changes. Your body grows quite a rapid pace over a 9-month period, and that rapid growth puts a tremendous amount of strain on the lower back. And also with the hormones that are released during pregnancy, it tends to relax a lot of the ligaments through the lower back here. The spine and the pelvis are only held together by a lot of large ligaments. And there's a lot of large muscles in the hips and the lower back that help give the lower back the strength that it has. But where the spine and the pelvis attach, there's only ligaments that actually hold these structures together. So with pregnancy, as the pregnancy develops and as the woman grows, their center of gravity tends to shift forward and the hormones relax all the connective tissue of the lower back. And that in itself can really predispose women to a lot of back issues during pregnancy, even in the early stages of pregnancy before they've actually grown a lot. And the other issue, once the baby arrives after pregnancy, the back again in itself can be quite weak still, but mum usually has a lot of repetitive lifting to do. You've got this young baby to lift in and out of cots and car seats on a daily basis. So that repetitive lifting can also lead to a lot of pelvic problems, sacroiliac joint problems, and weakness within the pelvic girdle and the core strength and core stability. So what chiropractic looks at is obviously to correct that. By correcting how the spine, the ribs and the pelvis are moving and functioning, it helps to improve how the muscles, the ligaments, the nerves, everything that attaches to the spine is functioning, so that you're not getting a weakness in the back and other areas of the back trying to compensate for that. So with that, by improving the joint movement through the lumbopelvic area as the first goal of treatment, any joint sprain of the body will usually take about 8 weeks to heal. And as I said, with the pregnancy as well, as the pregnancy progresses, it invariably leads to more postural strain being placed on the back. So the further into the pregnancy, potentially the more frequent troubles women can have with their lower back. So once you start to improve how the joints of the spine and the pelvis are moving and functioning, the patient's starting to feel better and getting back to their normal routine, which as I said usually takes about 8 weeks or so. A second goal of treatment is to then improve the strength and flexibility of the back, rehabilitation work. So we will start to give patients specific stretches and exercises to improve the strength and flexibility of their back, their core strength, and also exercise for balance and proprioception and so on. And it's at this stage that Pilates and yoga classes are very helpful to improve that core strength. And also the back strengthening classes that we have. Moray, one of the massage therapists that works in the clinic here, has designed an 8-week back strengthening course to gradually help to strengthen the back and rehabilitate the back over time. Our ultimate goal is to make sure people don't get ongoing back problems. To help strengthen and rehabilitate the back, to allow the body to repair itself, is what will get to the underlying cause of the problem. Please give the clinic a call. As I said, we can hopefully answer any of your questions or help give you the information that you're looking for. Thank you.